In health news this morning, 1 in 10 people in the United States has a rare disease. Spectrum Health, in partnership with Michigan State University College of Human Medicine and Calvin University, are excited to recognize Rare Disease Day. Now, this shines the light on many patients and families who are touched by rare diseases. Here to tell us more, Dr. Caleb Bupp. Dr. Caleb Bupp. I'm going to say it right. You're the division chief for the medical genetics at Spectrum Health, and genetics plays a big part in this, I hear.
It sure does.
Thanks for being here this morning, doctor.
Sure.
So what constitutes, let me start with this, what constitutes as a rare disease? How does one get that distinction?
Well, it sort of depends. You can look at numbers, but I think patients and families would tell you that you can look at the numbers, but it doesn't touch the heart. I think rare disease is anything that just isn't common, and I think that is something that people get, right? You go to the doctor, something's wrong, and you get kind of that look from the doctor of, we're not exactly sure what's going on here, and typically it's an illness and it goes away, but think about patients that live with that their entire lives.
Not to take away from other illnesses, heart disease and lung cancer, we hear about breast cancer, we hear about all these other diseases with massive fundraising efforts behind them. You gotta these families have to feel left out. They have to feel like left out in the cold, like what about us? Who's gonna help us out?
Right, and that's kind of the point of Rare Disease Day, right? You have all these individual conditions that themselves are rare, but when you put it all together, 1 in 10, it's not as rare as we think.
Yeah, well, 10%. So how did Rare Disease Day come about? Were you behind this? Did you start this?
Well, I won't take all the credit. So Rare Disease Day started with a phone call with a patient's mom who has a child with a rare disease, and she just kind of had been through this process of, what is this? Processing it, and then what are we going to do about it? And this is our 3rd year doing this event. It started as a gathering of families at Helen DeVos Children's Hospital, just in the cafeteria, sharing stories. And this year we've blown it out to a full-day symposium that's really a regional event now.
That's phenomenal to start that grassroots movement of people, and they found other like-minded people,
right.
As you said, not that rare, with 10% of Americans. So what is the hope for the event? Result? Like, what's the end goal here?
So I think the end goal, first off, is just to connect patients and families, to give that sense of hope, that sense of belonging, that sense of other people have been through this too. The second is just to provide a venue for education, for learning, because these things are not, there's not a lot out there for it. So this is a way to kind of take a lot of uncommon things, bring them together, look for the common things, and then move forward there.
And what are you hearing from the families? What are the challenges that they're facing?
So what you hear a lot is loneliness, is hopelessness, is no one else understands this.
Sure.
And that's where, just sharing that story with someone else who can empathize means so much.
I bet it does. I'm sure just step one, being diagnosed. I mean, that's the key. If you don't know what you're fighting, how can you fight it? Right. So, I mean, I'm assuming having a rare disease, you're going through so many different tests just to figure out what it is.
Right,
Go ahead.
And then you get to that, right? So I have my diagnosis, and you say, well, what are we going to do about it? And the look you get is, we don't know.
We don't know what to do.
If there aren't a lot of other people that have this, we're going to kind of do our best and figure it out, but that's still a hard place to live in.
And you did mention genetics at the top of this interview, and that is something that it plays a big role in in rare diseases, right? Genetics play a big part of this?
Exactly, yeah. We have 20,000 plus genes, and as much as we may think it, we all have errors in our genetic code, right? And sometimes that causes a rare disease, sometimes that causes us to be just kind of our quirky selves, but that's definitely a part of it.
Yeah. Unfortunately, Leanne doesn't. Her genetic code is perfect. But other than that, the most I understand what you're saying.
There you go.
It's a given, right? So in the event isn't just open for these families, right? This is open to everyone.
This is open to everyone.
So I mean, if you're looking for someone, if your heart goes out to these people, or maybe you know someone who's gone through this process, it's really open to anyone who wants to show up, right?
It really is. Patients, families, community advocates, people that just have rare disease folks in their lives, teachers, therapists, students, and folks that are just interested in medical science and research.
Yeah, I mean, maybe it's just an area of interest for you, right? And we had the information up on the screen. Rare Disease Day Symposium 2020 is happening Saturday, February 29th from 8 to 3, Calvin University at the Prince Conference Center. Now, people can pre-register for this, right? The cost for the event?
Free.
That's a good cost. So, but they do want you to pre-register so they know how many people are coming. That always helps. Registration closes February 21st, so just under a week. Thank you, Doctor, for the information.
Thank you.
And congratulations on this growing and growing, and hopefully it continues to do so.
Absolutely.
Thanks.